Welcome to the Lumbar Surgery Physiotherapy programme. This video was developed with funding from the Managed Service Network for Neurosurgery and is used in neurosurgery units within NHS Scotland. The video will give you information about what to expect following your spinal surgery, advice on how to return to activity, and exercises to help you regain movement and function. The advice applies to post-operative recovery from lumbar discectomy and microdiscectomy, laminectomy, decompression and spinal fixation. Your physiotherapist and other members of the healthcare team will be available after your surgery to answer any questions you may have. Your spine is made up of 3 different regions: cervical, thoracic and lumbar. Your surgery is in the lumbar region of the spine. The spine is made up of bones, discs, ligaments and muscles, which each have an important role in providing our back with strength, shock absorption, flexibility and movement. The spinal cord runs through the spine, stopping at the lumbar area where it splits into nerves which exit the spinal cord between the vertebrae. Lumbar surgery is carried out to try to improve leg pain caused by stenosis, narrowing of the spinal canal, disc prolapse or spondylolisthesis, slipping of the vertebra. Let us explain in more detail. Spinal stenosis is a narrowing of the spinal canal, which puts pressure on the nerves and causes pain. Laminectomy or decompression surgery is used to increase space within the spinal canal and reduce the pressure on the nerves. Disc prolapse occurs when the central part of the disc, the nucleus, bulges or prolapses through the outer disc layer and presses on the nearby nerve, causing leg pain. Discectomy or microdiscectomy surgery is used to remove the protruding part of the disc and relieve the pressure on the nerve. Only the protruding part of the disc is removed, but for the first 2 weeks after surgery, the shock-absorbing qualities of the disc can be compromised, and you may be advised to restrict sitting times to 15 minutes at a time to minimise pressure on the disc. When one vertebra moves and slips forward on the vertebra below it, it can cause pressure on the nerve that runs between these bones. This is known as spondylolisthesis. Surgery for this condition involves fixation of one vertebra on the other to prevent slippage. All surgery is aimed at reducing leg pain and not any back pain you may experience. Sometimes after surgery, you may experience discomfort and stiffness in the back due to the structures that are moved or separated during surgery. The physiotherapy post-op programme is aimed at reducing this discomfort and regaining movement and strength following surgery. Understanding how our bodies heal following lumbar surgery will help to guide you when deciding what activities you are able to restart. There are 3 stages to the healing process. These stages overlap and the timescales are a general guide. Later in the video, you will find advice on how and when you can start everyday tasks. If you're unsure about when to return to specific activities, please speak with one of the physiotherapy team for advice. The first stage of healing begins immediately after surgery. This is the inflammatory stage and can last up to 2 weeks. During this time, the body sends a mixture of chemicals to the surgical area to start the healing process. This can cause pain and increase pressure around the area. It is important during the inflammatory stage to minimise strain on the tissues within the lumbar area, as this can prolong the inflammatory stage and delay healing. To do this, we recommend that you change position often with minimal sitting. You should walk regularly and avoid bending and twisting movements. You are advised not to drive during this stage and not to do any heavy lifting. Keep watching for examples and advice on these activities. The second stage begins as the inflammation reduces and continues for about 6 weeks following surgery. During this regeneration stage, the body begins to produce scar tissue. Scar tissue helps to heal and strengthen the wound, both on the skin and internally around the ligaments and muscles. Scar tissue is very strong, but can form in a haphazard manner, resulting in reduced movement in the lumbar spine. The third stage of healing, the remodelling stage, ensures that scar tissue around the muscle, tendon, skin, bone and ligament becomes normal, healthy tissue again. Scar tissue remodelling occurs as you start to stretch and pull on it. Stretching the scar tissue helps it to align correctly and makes the tissue better able to tolerate the forces that are placed on it during the day. The whole process of healing takes around 12 weeks for the scar tissue to develop and strengthen. Following surgery on your lumbar spine, it is important to regularly change position to minimise post-operative pain and promote healing. Finding a comfortable position can be difficult and will vary from person to person. It's worth spending some time to see which positions work best for you, but here are some starting ideas. In this position, your lower back can arch, which may not be comfortable for the first few days. To avoid this, you can place a pillow or two under your knees. Lying on your side can be comfortable, as it does not place direct pressure on your wound. Try placing a pillow between your knees to help keep your pelvis level and your back well aligned. You can also try a small cushion or towel at your waist to support this position, or a pillow behind you to prevent you from rocking backwards. If you are able to turn onto your front, you may find this position comfortable. We recommend that, if lying on your front, you place a pillow or two under your hips to reduce the arch on your back. Getting in and out of bed can be more difficult in the first few days following surgery when the wound is sore. Let us demonstrate the best way to get out of bed, keeping the back in a good alignment. Turn onto your side facing the edge of the bed. Allow your legs to drop over the edge of the bed and use your arms to push yourself into a sitting position. When getting back into bed, lie onto your side first, then lift your legs in. Previously, we mentioned that you should minimise the time spent sitting for the first 2 weeks after surgery. When you do sit, try to find a supportive chair that is not too low. Your knees should not really be higher than your hips when seated. At home, you may need to add an extra cushion to a lower seat to increase its height. You can use a cushion, a pillow, or even a rolled towel to provide extra support for the lower back. You should aim to be relaxed and comfortable, but also maintain the natural S-shaped curve of the spine, even when sitting. Try not to let your lower back push out into a C-shaped curve, as this puts extra strain on the back as it's beginning to heal. Keep your feet on the floor if possible. Sitting with feet up also tends to move your back curve into a C shape. If you have had any surgery performed on the discs in your back, a discectomy or microdiscectomy, for the first 2 weeks we ask you to limit sitting to a maximum of 15 minutes at a time. You can do this up to 4 times each day. Often, just sitting for meal times, sitting to use the toilet, and short car journeys as a passenger can be enough. Between 2 weeks after surgery and 6 weeks after surgery, you should try to gradually increase the amount of time that you sit until you can comfortably manage 30 minutes at a time. If you have not had surgery on the spinal discs, you may be able to sit for longer spells even during the first 2 weeks as comfort allows. However, general advice for maintaining a healthy back suggests that after 30 minutes of sitting, everyone should stand, stretch a little and move around before returning to a seated position again. If getting home from hospital involves a long journey, try to follow the advice for sitting well and stop regularly for breaks to get out of the car. Walking is generally considered to be an excellent form of exercise, and this is equally true after having lumbar surgery. Following surgery, most people will get out of bed and begin walking around the next day. You may still feel some pain in one or both legs after surgery, but it is important to get moving again despite this, as it may take some time before this settles down. You may also feel some pain in your back around the area of the operation. This is normal, but it is a good idea to take adequate pain relief so that you feel able to move around well. Regular walking, position changes and pacing yourself throughout the day, doing little and often, can help you manage your pain. Some people may find that heat or ice packs provide pain relief, but we advise not to use these for the first 2 weeks following surgery. Please tell your nurse, doctor or physiotherapist if you feel too sore to allow you to get out of bed or walk. You may feel lightheaded when you first get out of bed, so it is a good idea to stand for a few minutes to allow it to improve. Then walk short distances several times during the day, gradually building up the time and distance covered. You may find that walking around in your room, on the ward, and getting to the toilet are enough initially. It is important to try to achieve good posture to avoid putting strain on the lower back. This may be difficult if you have been using a stick or crutches for a while prior to surgery. But even if this is the case, it is worth trying to achieve good posture by standing and walking as tall as you can. Before going home, your physiotherapist will check that you are moving as well as possible and that you can manage up and down stairs if you need to do this at home. Once home, you should try to do several short walks every day. Start with short distances that you know you can manage and gradually build up the distance and pace. 8 weeks after surgery, most people can manage to walk a couple of miles if general health allows. Even while the dressing is still covering your wound, you are allowed to shower. Nursing staff will advise you about replacing the dressing when required. We do not recommend that you have a bath for the first few weeks, as it is difficult to sit in a bath without placing your lower back in a C-shaped curve, which can place extra strain on the healing tissues. Instead, you can stand in the shower or wash at the sink. You may find it a little difficult to put socks, tights or underwear on at first. Most people manage to reach their feet to do these tasks by sitting upright and crossing a leg up onto the lap. Others bend forward to reach the feet, but do so slowly and take care to avoid twisting at the same time. Bending the leg to bring the foot closer can also help. To put on and tie shoes, stand, lift and place your foot on a raised surface and gently bend at the hips to reach your foot. Try not to lift anything heavier than about 5 kilograms or 10 pounds for the first 2 weeks. Some examples of typical items that weigh 5 kilograms are a full kettle, a load of washing, a vacuum cleaner and a pan of pasta and water. From 2 to 6 weeks, you can gradually increase the weight of items, but it is important not to place excess strain on the tissues of the lower back within the first 6 weeks by lifting heavy objects or by bending and twisting at the same time. These activities can cause pressure to move towards the back of the spine where your tissues are still healing, and it may increase inflammation and pain again, making healing take longer. When picking up items from the floor or a low surface, kneel down if possible, or bend slowly using your knees and back, and make sure you don't overstretch. When turning to lift something from the side, stand and move your feet instead of twisting at the waist. After 6 weeks, you can begin to take on more normal activities, knowing that the scar tissue is developing and becoming stronger. There are a number of other household tasks that you should try to find an easier way to do in the first 6 weeks after surgery. Any activity that involves leaning forward from the waist for several minutes at a time may be uncomfortable. These include washing dishes at the sink, brushing teeth over the sink, ironing and vacuuming. Try to maintain an upright posture if you can. A good way to do this if you are standing is to place one foot on a small step in front of you while you do the task. This may mean opening the cupboard under the sink and gently placing your foot on the bottom shelf, or placing a sturdy box on the floor to do the same. You must not drive for 2 weeks after lumbar surgery. In our experience, you may not feel ready to drive again for 4 or 6 weeks though. This may be due to taking strong painkillers or not feeling confident about sitting for longer spells. It is most important that you feel comfortable and confident to operate a vehicle and manage an emergency stop. It is also important to check with your car insurance provider before starting to drive again, as they may have specific rules about returning to driving after lumbar surgery. Many people feel they can return to work 6 or 8 weeks after surgery. This does, of course, depend on the type of work that you do. Returning to heavy manual work may take longer, as you will have to ensure you have allowed enough time for tissues to heal and strengthen. From about 6 weeks after surgery, you can begin to introduce more strenuous activity, and this might include gradually returning to sport or exercise, manual work, or gardening. This may be a good point to mention that sex is fine whenever you feel able. Choose positions where you feel comfortable. If you are unsure when you should consider returning to work or hobbies, please speak to your physiotherapist for advice. You will be asked to perform daily exercises following your lumbar surgery. The exercises in the lumbar surgery physiotherapy programme will help you to gradually stretch out the scar tissue as it forms and improve the strength around your lumbar spine. Before you start any exercise, you should ensure you have a comfortable place to perform the exercises. Lying on a bed is ideal. Exercises should be performed 3 to 4 times each day. They should be performed within a pain-free range of movement. Don't try to reach the full movement too quickly. Exercises should be done slowly, with movement and repetitions built up over time. Any discomfort felt following exercise should not last more than 20 minutes. If it does, next time don't stretch as far or reduce the number of repetitions of the exercise. The first exercise is called transversus abdominal setting. This works on the stabilising muscle of the pelvis to help provide a corset-like support for the spine. Lying on your back with your knees bent, place your hands on your hips and press your fingers over the top of your pelvis. If you cough, you will feel the trans-abs muscle pushing against your fingers. This is the muscle we are going to exercise. There are several ways to activate this muscle. Try the following and see which works best for you. Imagine you're pulling your tummy button towards your spine and under your ribs. Squeeze your pelvic floor muscles as though you are stopping a flow of urine. Imagine you're pulling up a zip on tight trousers. Once you're able to feel how to activate this muscle, you can gradually increase the time of contraction or hold of the muscle. You should aim to build up to holding the contraction for 10 seconds, repeated 10 times. This is not an effortful contraction, and your breathing should be relaxed throughout the exercise. There is no movement of the spine during this exercise. It's a static hold. As your control of this muscle improves, you can practice using it during everyday activities. Before performing any of the following exercises, you should be able to activate and hold the trans-abs contraction. Once you are able to activate and hold the trans-abs contraction as instructed in the core setting exercise, you can introduce these gentle stretching exercises. The pelvic tilt exercise gently stretches the back. Lie on your back with your knees bent and place your hands into the hollow at the base of your back. Activate your trans-abs muscle. Gently press your spine into your hands, allowing the back to curve as you do. Hold this position for a few seconds. Then slowly arch your spine away from your hands and hold for a few seconds before returning to the starting position. Repeat this stretch up to 10 times. Remember to move within a comfortable range. You will be able to gradually increase to the full range over time. The knee rolling exercise introduces a controlled rotation or twisting stretch. Again, remember to stay within comfortable limits with this exercise and build up the movement gradually. Lie on your back with your knees bent and activate your trans-abs. Keeping your knees together and your shoulders on the bed, slowly let the knees move to the side as far as comfortable. Then bring the knees over to the other side. Repeat this movement up to 10 times. These exercises are aimed at further strengthening the core stability and support muscles around your lumbar spine. Most people are ready to begin these exercises around 4 weeks after surgery. Before you start, please ensure you are able to activate your trans abs muscle. You can review the video for the overview of exercise and core setting if required. This exercise works the small muscles, the multifidus, around your spine, which are important for stability. Start in a standing position with one foot slightly ahead of the other. Place your thumbs on either side of the spine. Activate your trans abs. Rock forward gently, pressing the front heel into the ground. Do not lift your back foot off the floor. You should feel the contraction of the muscle under your thumb. Hold this steadily for 5 seconds, then rock onto the back foot and hold for 5 seconds, feeling the change in contraction of the muscle. Try to keep your trans abs contraction throughout. Repeat up to 10 times. The leg slide exercise uses all of the core muscles that you have been working following surgery. Lying on your back with your knees bent, activate your trans abs muscle and hold the contraction throughout the movement. Slowly stretch one leg, then slide your heel towards your bottom. If this feels comfortable, lift your knee towards your chest. Do not force the movement. Repeat with the other leg. Your back should not arch or curve during this exercise, and you should only move your leg as far as the control of your back movement allows. You can place your hands under your back to help feel for movement. You should be able to hold your trans abs contraction throughout this exercise. If you are not yet able to do this, continue working on your other core stability exercises and return to this in a few days to try again. Your physiotherapy team will be available after your surgery to answer any questions you may have. If required, you may also be referred for ongoing physiotherapy after surgery. Once you are home, you may occasionally find that you feel an increase in pain or perhaps altered sensation in your legs or back. Usually this is nothing to worry about, and taking care to move well and rest a little more for a day or two will often improve things. However, you should contact your GP if you notice any wound swelling or signs of wound infection, if you notice changes that do not seem to go away, such as loss of feeling or weakness in your legs, increased pain, or problems urinating and controlling your bowel movements. There are many places to find out more about back care and activity to help answer your questions. These websites are an example of some of the information available. Or you may wish to use an app for smartphone and tablet. Search your App Store or Google Play for NHS24 MSK Help. Thank you for listening, and we hope the information will help you towards a smooth and healthy recovery from your lumbar surgery.